I'd like to introduce Sheehan, who's the head of business at Vodafone UK, and she can tell us a little about what their plans are going forward. And so glad to have you here.
Yeah, good morning, Shafi, and good morning, everybody. I hope you've all managed to get on the platform okay. So thank you, Shafi, for the introduction, and it's great to join everybody at this amazing virtual event. I know we're all getting used to the world of virtual, and Vodafone is really proud, Shafi, to be the sponsor today. Health sector has been hugely important to Vodafone, actually now more than ever, and I think COVID has shown us how important both health and care is for the communities in the UK across the globe. So we've got some exciting speakers lined up over the next hour or two. So I think hopefully, and then a great Q&A event. So hopefully we get some really lively participation around some of the very topical things that we're going to discuss around technology and how it can help transform healthcare.
So I guess the question for me really is around Vodafone's, interaction with healthcare. So why is healthcare so important to Vodafone, Anne?
I think, I think technology, as I think we can all agree, has played a really important role in supporting health during the pandemic. And technologies, which we'll talk a lot about 5G in the panel discussions later on, but the technology has shown how it can completely transform the delivery of care. And interestingly, prior to COVID, Shafi, you and I and some of your peers had a lot of discussions around the future, the vision, trialing the technology, what it could do. And actually, what COVID has done is it's no longer a vision, right? It's here, it's live, we've got use cases in the UK. And I think if I look at the health sector already, we've seen some incredible technologies really deliver better patient outcomes. And also we've seen it help train and educate a new generation. So from our perspective, we really see that the UK actually could be a really global leader from a 5G perspective. Now, I guess to kind of bring down to practicalities, right? So we do understand that technology can be expensive, and in a lot of scenarios, health sector hospitals have to be wise with their budgets. They don't have a lot to invest. And therefore, I think what we need to do and what we've learned from COVID is we really need to enter into more partnerships. So move on from a supplier, so Vodafone being a supplier to the industry, to more being partners, co-creating, co-collaborating, and trying to make it more about outcomes as opposed to big investments up front. And I think as the technology partner, we're there to support. And what we want to do is provide flexible and secure solutions, but start small. And some of the things that you'll hear the panel discuss later on, for example, is why don't we create in a hospital one 5G operating room together, one 5G hospital bed, a 5G connected ambulance. And therefore we start small, we test, we try, we learn. And actually then we can, come on a journey together to transform healthcare in a scalable, I think, secure and cost-effective manner. And this morning you're going to hear from a team of experts that we've pulled together that are leading in their field. So Nadine, who we know is the CEO of Proximie and is really an innovator who has really challenged the status quo technology. You'll hear from Scott Petty, who's the CTO of Vodafone, who will really talk about what we've done in terms of innovation to meet the challenges, and then hear direct from the front line from Phillips at the University Hospital in Southampton. Also, in this virtual world, we always have breakout rooms and virtual stands. So please try and make the effort to go to a virtual stand where you can really get more in-depth discussion going on how we are using some of the new technologies like 5G, mobile private networks, mobile edge computing, all these new buzzwords that we'll hear, but actually genuinely our views on how we can use them for better patient outcomes. Yeah. And I think last, before I hand over to Danny, is, we really see 5G and technology as a force for good. We're really, really excited, Shafi, about the possibilities. We really want to work in partnership. So let not the traditional way of looking at things about we need big budgets, big procurements. Let's just try, do things together. We've got the technology. It's in all our interests to use that, put that technology to good and to do trials in hospitals to see, what we can create together. So now I'm going to hand over to the Head of Innovation for Vodafone UK, Danny Kelly, who's going to tell us all about the great things that we've been doing in this space. So thank you, Shafi.
Thank you.
Hi everyone, my name is Danny Kelly and I am Head of Innovation at Vodafone UK. So firstly, let me take the time to thank you for watching this presentation today. You've got me for the next 30 minutes and I promise to keep this as fast-paced and as engaging as possible. So today I really want to have a conversation or a discussion with you around what are the technology changes that are underpinning some really transformative outcomes within the healthcare sector. Those technology changes are very much being driven by new technologies such as 5G, IoT, the Internet of Things, or MEC, multi-access edge compute. And what we've seen is when we combine all of these technologies together, it's really given us a real ability to deliver truly transformative outcomes in healthcare and beyond. So by way of a signpost in terms of what I'd like to cover today, it's really have a conversation around the accelerators and the inhibitors to that technology adoption. I'd like to get us all on the same page in terms of what is 5G, actually what are the key attributes of 5G and how does that really work. I'll talk through some of the changes that Vodafone are already involved in within different hospitals and organisations across the UK and further afield in terms of delivering transformational outcomes within healthcare. And then actually I thought it'd be useful if we stepped out of healthcare for a minute and we have a conversation around how we're taking those key attributes from 5G and MEC and IoT and we're applying those in other industries. So in this case, I'm going to look at transport and logistics industry, just to give you a view of how we're going to see some changes in that sector in the very near future also. And then we'll round off with an animation video of what Vodafone sees the hospital of the future and the very near future at that look like through the power of harnessing these new technologies. So with that said, I thought it'd be useful just to get us all onto the same page if we watched a short video with regards to Vodafone's vision for connected health in the 21st century.
2020 has been a year like no other. We've gained a renewed appreciation for health workers, experienced astonishing technological progress, and made public health a global priority. But we've also seen challenges in the current system exposed like never before. We stand on the brink of revolution. The UK is digital, and patients across the country are ready to embrace a new way. Imagine a future where at-risk patients can be remotely monitored in real time, and medical staff can share health data instantly. It's time to reimagine healthcare. From fixing basic hospital inefficiencies and replacing silo mentality with a more holistic approach, to implementing and enabling advanced technologies like 5G and AI. We have the collective vision and momentum to make it happen right now, but we can't do it alone. Together we can replace the old model with something faster, smarter, and more patient-centric. Together, we can innovate safely, build trust, and learn at speed. Together, we can make connected healthcare a reality.
So hopefully that short VT gave you some idea of the great work that is already underway today in the healthcare sector. However, if we want those changes to become a common reality, it will of course require a much broader adoption of the technology that is underpinning those changes. What we do know for certain is that we are now entering into a period of exponential change in the technology sector, and as a result, new technologies such as 5G and IoT and edge compute capability will allow a number of industries to completely reimagine themselves, to self-disrupt. And we absolutely know for certain that the healthcare industry is at the forefront of the adoption of those new technologies. Now, there's a number of reasons for that, I'm sure. However, without doubt, the pandemic has played its part. So whilst we do know the pandemic completely disrupted the global supply chains, what we do also know is that the pandemic brought with it a positive change in that healthcare has been reimagined. We've been thinking about new ways in which we can deliver traditional services in new channels, not old channels. And actually what we're also seeing is a mindset change in terms of patients and their willingness to accept the engagement with new channels as a form of healthcare provision. So we've not just seen that here in the UK, but we've seen that globally. And throughout the pandemic, we've actually seen technology be used as a central part in terms of delivering some of those changes. We've seen, as a result of 5G adoption in very many places, we've seen new ways in which we could offer healthcare services. VR, virtual reality surgery preparation, augmented reality surgery, remote patient monitoring, drones and robots. We've seen those being used in Wuhan province to disinfect hospitals. We've seen 5G robots being used for medical delivery and medication delivery. 5G has played a key role within the pandemic, whether that be through the introduction of new services or the reimagination of existing services. Therefore, it might be worthwhile taking a step back and saying, what are the key challenges in the healthcare sector today? And through a 5G lens, how do we begin to address them? So if we look at 5 key challenges that we know exist today: decentralization and accessibility. How do we leverage this new technology to remove the borders for knowledge? How do we ensure that it's accessible to all? Through new things like telemedicine, remote consultation, remote diagnosis, remote ultrasounds. All of these things play a part today. 5G can begin to really make these technologies mainstream and help address that particular challenge. We then have digital learning and collaboration. So we know that throughout COVID, it's been a real challenge to get medical students into the operating theatre. Do we need to do that in the future with technologies such as augmented reality or virtual reality, when we can beam students into the operating theatre for live learning? And we're already seeing great examples of that today with great companies such as Proximie. And of course, Vodafone, you'll see one of the examples later, is involved with some universities around the country to ensure how do we do this from an education setting as well. Emergency care. So how do we reimagine emergency care as a result of 5G? How do we use the attributes of 5G in terms of its benefits of low latency and high speed and high bandwidth to deliver real-time information between the ambulance and the hospital? And there's lots of applications that we can then apply to really change frontline response. Community and social care and personal care. So how do we begin to think about that secondary care or treating chronic illnesses in the home? So really improve the lives of people suffering with those chronic illnesses, removing those journeys to the hospital. And then lastly, hospital workplace digitization. How do we begin to address the technology changes from a hospital perspective? And of course, infrastructure is at the heart of the challenge here. So we've got a number of legacy systems and legacy information stacks that need to be addressed. And therefore, it's incumbent upon operators such as Vodafone and the ecosystem of partners who will create these great applications to do so in a way that are open, that are flexible, and that are scalable so they can be adopted at pace. This will not be a big bang approach. It may be an agile approach depending on the institution, and therefore we've got to work together to find what works best for different organizations, but ensuring at the heart of all of this that what we bring to market is open, is flexible, and is scalable to ensure that we can deliver these services. So with that said, it might be worthwhile now having a look at what is 5G, what are its key benefits, and actually how do we apply them in the real world. 5G is here and it holds the key to a new era of wireless transformation. So please do forget about anything you may already know about the other Gs, 2G, 3G, 4G. 5G is not an evolution of the other Gs, it is without doubt a revolution, and it brings with it the ability to completely transform every industry vertical. And as I mentioned before, healthcare is absolutely front and center in that. So whilst the evolution from 3G to 4G allowed us all to watch Netflix on our phone a little bit faster, actually the evolution from 4G to 5G is not the same. It is completely transformational and offers us a very many different opportunities to reimagine services in their entirety. So with that said, let's have a look at those key attributes of 5G and understand a little bit more about them. The key attributes of 5G are, of course, speed, latency, bandwidth, and capacity. And the best way to think about these is with a simple metaphor. So if I use a motorway as an example, speed, self-explanatory, it's really about how fast you can go. And of course, 5G enables you to go very fast. Latency is about how quickly you can react to other cars on the motorway. And bandwidth is really about how many lanes we can have going in one direction, and 5G really opens that up and gives us a lot of lanes on the motorway. And then lastly, capacity. Capacity is about how many cars can be on that motorway. A lot of cars, the bumper to bumper, that are interacting with each other without any sort of disruption. So that really is the power of 5G. But what does that really mean from an application perspective? So look, let's bring that to life with some healthcare applications that you'll know and and recognize. So here we have a simple axis of network speed and latency, and we've plotted against this on this particular slide just some examples that 5G really enables as a result of its ultra high speed and ultra low latency, which is absolutely dependent for some critical services. So just to bring some of this to life, I'll draw your attention to the green symbol at the bottom of the page. There we have human visual reaction time. And the reason I call that out, it really takes about 13 milliseconds for your brain to pick up an object and recognize what that object is. With the power of 5G, we can take speeds and latency all the way down to as low as 1 millisecond. And that's incredibly fast, but completely necessary if we're to deliver new applications, such as, for example, autonomous cars on their roads. They will need high speed. They'll also need that low latency from a decision-making perspective. And you can also see that in use cases from a healthcare perspective. So some examples on the page here, you can see connected ambulance, whereby it doesn't need as fast a latency as some applications, but it does absolutely need that real-time high speed to enable that real-time connection between the ambulance and the front line and of course the hospital staff. And if we look at some of the other applications, remote surgery application or immersive AR, VR or healthcare robotics, these things require ultra low latency and of course high speed. These things are only possible as a result of 5G. They were not possible because of the other Gs, and therefore we've really been waiting for these technology change to completely unlock these applications. So what does that mean for clinicians and for patients in the real world? It's really about how we no longer beginning to adapt but explore. It's no longer about supporting patients' care, but it's empowering patients' outcomes. It's no longer about reacting, but it's preventing, and it's no longer about ensuring availability, but it's unlocking accessibility. So let's just talk about them one at a time. We used to adapt, but now we can explore. Explore what? We can remove the boundaries and begin to explore new possibilities with the introduction of new services. We touched upon a little bit about that today, but the connected ambulance is a great example of all of the things that we can now use 5G to unlock within the world of a connected ambulance for the future. Supporting patients' care, well, now it's about empowering those patients independent. How can we decentralize healthcare? How can we offer healthcare in the home and remove the need for trips to the hospital and actually give patients their lives back? That's what 5G can enable. It's no longer about reacting, it's about preventing. So how do we use new technologies such as digital twins to predict and understand outcomes before they're deployed so that we can begin to reduce errors in the real world? And then, of course, ensuring availability, unlocking that accessibility. So how do remote technologies, which we're beginning to see adopted, such as remote diagnosis and remote consultation, those things, how do we ensure that they become mainstream through 5G to really transform the healthcare sector? So with that said, I think it'd be useful now at this point to go ahead and have a look at how's Vodafone taken those capabilities from 5G, ultra high speeds, ultra low latency, and taking some of these advantages in terms of decentralization of healthcare and digital twins and applying those in the real world to deliver transformational outcomes today. Of course, we want to see those expanded into the healthcare sector. That will take time, but I think we're already starting to see the seeds grow from a technology adoption perspective, and it's good to have a look at some of those opportunities. So Vodafone is beginning to shift the dial on healthcare provision in the UK and beyond. But actually, when we do so, we're not doing so independently. We are very much dependent upon a whole raft of partners in the ecosystem to come together to really deliver those transformative outcomes. Differences between 4G and 5G. 5G has a dependency upon an ecosystem to really take advantage of the benefits that we can bring from a network and technology perspective. So if I just give you 4 examples today of where we're involved in the UK and further afield from a Vodafone perspective in terms of really taking those attributes of 5G and applying them in the real world. So the first example I'd like to share is the work that we're doing to deliver the UK's first 5G connected hospital campus. And there what we've done is partner with Proximie to enable the hospital through 5G to deliver augmented and virtual reality assisted surgery. And that, of course, addresses one of the major challenges in terms of decentralization and accessibility. But what we're also doing there is addressing learning and collaboration, because we will enable through that application from Proximie live learning from the operating theatre to the university campuses. And that is really important in terms of our ability to address multiple needs. So great work there from our partner Proximie, a great application, a great solution, and it's great to be seeing this being adopted into a UK hospital through the power of 5G. Sticking with learning and collaboration, if I move on, we're now working with Coventry University to deliver an interactive VR remote learning capability at Coventry University. Again, this will be the first of its kind in the UK. It's the first enabled interactive 5G remote learning capability, and what will enable there is really a 5G AR VR virtual tour of the human body, and I believe that has really ushered in a new era of education through the power of 5G, and we'll begin to see this become more common across university campuses across the UK for different industries, not just healthcare. But it's great to see that healthcare again are really pioneering these changes within the education industry. So I talked a little bit about it today, connected ambulance. We're working in Milan on the connected ambulance. We've got a number of projects in the UK on connected ambulance. The beautiful thing about connected ambulance is there's so many applications that we can now deploy into the connected ambulance to really transform frontline and first response healthcare. I'm not going into all of them today, but I'll touch upon a few of them. 5G, of course, offers us that ultra high speed, which is necessary for those HD video calls, and therefore connecting the ambulance paramedics to the hospital staff with, allowing them to see at first hand what's happening with patients in front of them. This can all be done through a audiovisual headset. Talking of headsets, we can use those headsets to offer paramedics operational protocols, so giving them a reminder or a nudge in terms of what they need to do next with different patients under different circumstances, depending on what is happening with them. We've got tele-ultrasound capability that we're able to share with real time with the hospital. There's multi-parameters whereby the vital signs of the patient en route to the hospital can already be transmitted to the hospital staff. And of course, visual recognition, something else that we can do. So a paramedic sometimes attend scenes and the patients are unconscious. Using a augmented reality headset, they could be able to identify who is that patient. It's from healthcare records and understand have they got any underlying health conditions. I mean, these are just some of the great examples that we can now see come to bear for the connected ambulance of the future. And these things are happening today. These are not things that we want to develop in the future. These are happening today already with a Vodafone footprint. And then lastly, in Dusseldorf, we have been working to create Germany's first 5G connected campus. We're looking there to address a number of challenges around personalised care and hospital workplace digitalisation. So what you've seen here is we're using 3D mixed reality library for surgery preparation. And we're also using that for monitoring patches for remote monitoring of patients in the home to understand their vitals ahead of surgery and the likes. So actually, there's two great use cases being developed there in Vodafone Germany. With that said, I thought it'd be good just to break out to a couple of other industries so that we could have a look at how else is Vodafone transforming services. And I already said up front that we would select transport and logistics. So why don't we go ahead and have a look at how Vodafone's playing a part in taking those same attributes that we're using to deliver transformative outcomes in healthcare and apply that to transport and logistics industry, so you can have an understanding of what you can expect to see in the future in that space. Transport and logistics, it appears, is hot on the heels of the healthcare sector in terms of its appetite to adapt these and chances to deliver different outcomes in this space. Vodafone is involved in a number of projects, both in the UK and further afield, and I'll just touch upon a few of those. Some of these actual examples seem a little bit far-fetched, but the reality is we're engaged and actively engaged on deploying these technologies today, and we can expect to see these changes on our roads or our waterways in the very, very near future. So with that said, let's talk about a few of these examples. The first one I'd like to talk to is the work that we've been doing with Ford at their plant in Dagenham. Really, they've adopted a mobile private network with some edge compute capability, and combined, these technologies have offered them a new way in which they can manufacture, in this case, electric batteries for electric cars of the future. So that race for electric cars on our roads is absolutely happening here in the UK, and 5G and edge compute capability is playing its part in terms of how we deliver that. Vodafone just won an award from DCMS, Department for Culture and Media, for our work at Ford Factory to really build a showcase for manufacturing for the whole of the UK, which is a great accolade. A little bit of bragging rights there. So let me just move on and show some other examples where we've been involved today. So the next one here I want to talk to is the 5G enabled autonomous ferries in Germany. Now, this looks a bit futuristic and probably a little bit unrealistic, but the reality is we're already underway deploying the technology along the waterways to make this a common reality. In this particular instance, what you'll see is these vessels will be completely autonomous, whereby the captain will be at home, able to navigate these vessels from the comfort of his own home. Hopefully not comfortable. I'm sure there will be a number of security measures in place to ensure that this can happen all safely. But actually, the conversation here is really about the power of the technology enabling this to happen in a safe way. We're also working with West Midlands 5G on their West Midlands 5G project to actually build the UK's first stretch of public road to test autonomous vehicles on. That's 180-mile stretch of road in the West Midlands. Great to see the West Midlands team really spearheading this into the UK and being at the forefront of the adoption of autonomous vehicles onto our roads. So we can absolutely expect to see autonomous vehicles being used in earnest on the roads in the West Midlands as the testing site for these onto the UK roads. We're also working with Hariba Mira, the Motor Institute Regulatory Authority in the UK, to build them a test track and facility for 5G autonomous vehicle testing. And again, that's just to test some of the technologies that we can deploy from an autonomous vehicle perspective before they make it onto our roads in the UK. So look, these projects are happening here and now. They're very real, and we can expect to see changes in terms of autonomous vehicles on the roads very, very shortly. Also, you may have seen in the press recently, Vodafone were working with a partner called Origo to deliver a autonomous bus at the PGA Golf Tour in Wales at Celtic Manor. We used that autonomous vehicle to get golfers from the clubhouse to the first tee in a fully autonomous bus, being of course deployed there on a private road. But actually it just shows you that that technology is available today, and it's only a matter of time before we will all see that as a common reality here in the UK on our roads. We are involved actively right across Europe and further afield in terms of these projects. There is a massive appetite for change in this space, only just behind the appetite that we're seeing come through from healthcare in terms of adoption of new services into that space. What I'd like to do now is step back in and have a look at a short animation video of what Vodafone perceived the hospital of the future to look like, with a number of these changes that we've talked together today and brought together in a little animation so that you can see what that might look like. So there we have it, a day in the life of a surgeon in the not so distant future. If only it were that easy, I can hear you say. What's clear from that video is that we are only scraping at the surface in terms of the technology advancements we can begin to deploy. Of course, we'll all have to work together to ensure that the long-term architecture can support this rate of change, making sure that it's open, secure and flexible. If we do so, then we'll be able to innovate safely and secure to make connected health a reality. And of course, if we put patient outcomes and user experience at the heart of everything we do, then the possibilities will be truly endless.
Hello, ladies and gentlemen. Thank you very much for the invitation to join this exciting panel with so many esteemed speakers and friends. My name is Nadine Hachach-Haram. I'm a reconstructive plastic surgeon at Guy's and St. Thomas's. and I'm also the founder and CEO of Proximie. And what I'd really like to share with you today is how we've been envisaging the potential of changing the world, the power of strategic partnerships that allow us to be stronger together as we ultimately work to improve the quality of lives of our patients all around the world. As a practicing surgeon, and I've been a surgeon for over 10 years now, I've worked both in the UK within the National Health Service, but also globally within multiple other health systems. And what I can tell you is that I witnessed firsthand some of those key challenges that we face in healthcare. Challenges around variation access, variation outcomes, and variation quality. And it always struck me as a conundrum. Why is it that patients don't get the same quality of care everywhere they go? And for me, it became a frustration and a drive to think about how do we change that process? How do we ensure that we can leverage solutions that allow us to ensure that patients, no matter where they are, get the best care the first time, every time? Some of that is about what we'll talk about today, and some of it is about a mindset, thinking about an operating room, a space that's so exciting yet so undigitized. And how can we digitize that environment to drive expertise, quality, and care? But of course, we always need to look back at history to understand a bit more about the genesis of surgery, this idea that was predicated on communication, collaboration, and co-presence. That by being together in a room, we can drive expertise, we can share and discuss different ways to do procedures. And whilst it's passive, was a way that drove us forward. And undoubtedly, we have to credit that time to a lot of the advances that we did make in surgery. And that environment is probably why we still call an operating room here in the UK an operating theater, that kind of amphitheater type experience. But if we fast forward to about 18 months ago in Texas, this was the case. We've probably demonstrated that we haven't adapted with the times. In a world where we're so digital in everything that we do, why is it that we still need to put tens and tens of people in an operating room to scale? And I'm sure you'd agree this is quite a passive way of learning, a passive way of communication and collaboration. And what do we know about what each of these individuals are doing when they then go back to their own operating rooms and their own hospitals to deliver that care to their own patient population? When we talk about variation, it really is anchored in evidence. This is not just an assumption or a hypothesis, but this is something that we see day in, day out. Here in the UK, we talk a lot about GIRF, to get it right first time, and mapping out that variation across hospitals within the NHS. But also within Europe and more globally, this is a challenge. And I can tell you that what often used to frustrate me was this misconception that variation of care really exists only in the developing world or the low and middle income countries. I can tell you that variation care is very much something that we experience day in, day out, and I'm sure other surgeons on this panel will agree to that as well. And these numbers that I put on the board here are numbers that are meaningful and are worrying. Here, for example, even in the UK, you're 14 times more likely to suffer complications of colorectal surgery, and these are numbers from other centers in Europe as well in other specialties. And so this idea of quite simply where you live determines if you live or how you live is something that is concerning, is something that we need to do something about, and we need to act on this. And we know, and as a surgeon, I can speak to this, as I'm sure the other surgeons will as well, is that the future of surgery is exponentially faster, smarter, smaller, cheaper, and better. We have a vision of where the future of surgery wrapped around the patient journey will be. I was very lucky to be one of the commissioners on the Future of Surgery's Royal College of Surgeons Commission. And we really looked at what does surgery look like in the next 5, 10, and 15 years. And we're optimistic, and we know that there's going to be a lot of interesting solutions that will continue to add benefit to our patients. Solutions such as computer vision, artificial intelligence and machine learning, and robotics. And of course, genomics and big data as we drive more towards a precision medicine. And again, augmented reality and virtual reality, which you would have heard about also from some of the other panelists. But for me, one of the absolute fundamentals to all of this is not the technology stack, but how is it actually delivering value to patients? There can be a lot of hype about different solutions out there, but ultimately, how are we using those solutions to make sure that we can benefit patients? And what I can tell you for a fact is ultimately wrapped around all of that is communication and connectivity allows us to save lives. Our ability to reach out to our network of surgeons nationally and globally can make an impact in saving lives. The power and potential of 5G connectivity is also going to take that to the next level. Particularly as we start to think about surgeries and videos around surgery, it's such a compelling use case to use 5G to really enable that connectivity that is seamless, ultra low latency, and meaningful for clinical care, transfer of knowledge, and delivery of expertise. And why is it impactful? It's impactful because it allows us to do things at more capacity. Nothing is left behind, so the bandwidth capabilities are much broader. But ultimately, it's about latency and low latency. What we really wanted to build in Proximie as a solution, and we'll talk more about it, was an ultra low latency experience. And of course, we've optimized our platform that even on 4G, we can deliver that ultra low latency experience where it's seamless, it's not buffering or cutting or having that less exciting or appealing experience. That being said, we recognize that we can do so much more with 5G, those high definition 3D views that we can drive into an experience, overlaying more and more structures and images from augmented reality and other tools that would allow us to do that. And we see the value of immediate insight. What we know is that information is liquid gold. This is a saying from Dr. Shafiq Rab. What we know is that getting the right information at the right time for the right patient is critical. It's those choices that we need to make that can be life or death decisions for patients. And so having that ability to really accelerate a higher infrastructure and architecture for connectivity is going to be so much more meaningful as we, as a global healthcare community, strive more for digital. This was, of course, accelerated and catalyzed by COVID, but undoubtedly, I think you'd agree that there was changes towards that happening even before COVID. What COVID afforded is that ability to move quickly. What we see as 5G's opportunities in healthcare is around decentralization and accessibility. It's something that we believe very much at Proximie. It's why we've built our platform the way we have. It's about saving lives by connecting experts. Again, on our platform, using Proximie, you're able to virtually scrub into operating rooms around the world to collaborate and connect. And how amazing it would be to use 5G connectivity to do that, to deliver emergency care, to support more impactful community and social care, and hospital and workplace digitization. So we see a lot of opportunities here, some which we are working on, but some that our partners and other healthcare systems are working on as well. And we truly believe that we want to save lives by sharing the world's best clinical practice. We understand that we've got fantastic surgeons all around the world. But imagine if we could then amplify their reach, amplify their ability to deliver care to patients, and really save lives by sharing their expertise with the best clinical practice and solutions to do that. So I'll share this video, which is perhaps our view on how we see the value of that connectivity. When we look at other industries, we see how they've moved very much towards data-driven methodology, data capture, and data sharing. And how having those abilities to do all of that in real time means that they're able to leverage that for future benefit within their industry. So in this case, we're looking at the athletics industry. Imagine if surgery pivoted into that component as well. And that's where Proximie is really driving that concept. And so I'll share this video with you, which I hope demonstrates that.
The pursuit, being better, the edge, the marginal gain, the unfair advantage. We've all been looking for it, no matter what we do. The truth is, there is no shortcut, no easy route. Technology is changing our pursuit. It's evolving before our eyes, creating endless possibilities. Just look at the world of sport, the modern quarterback, the new age domestique, the pre-game plan, the post-game review. Every angle, every possibility, every inch. Watched, reviewed, understood, applied. What about the clinical world? At Proximie, we enable clinicians to virtually scrub in and collaborate with each other from anywhere in the world, allowing any clinician to prepare.
What I tend to use is a horizontal incision.
To perform.
Everything is about triangles and the proper planes of dissection. So the top of your triangle is where you're going to come across.
And perfect their craft.
Question there?
Yeah, Ben, I wondered if you make a comment as to how you pitch that. Is it such that the labrum is flushed to that preparation zone?
Yeah, I'm so glad you brought that up, John.
Pre, during, after. Think of us as your game tape. Start your pursuit today. Plug in Proximie. Connect clinicians. Save lives.
So I hope what that video has shown you is that our thesis is very much about how do we digitize the global operating room? How do we ensure that we can really aggregate meaningful information, actionable analytics, but ultimately connect surgeons all around the world to deliver care to patients wherever it's needed? Our applications are varied around preceptorship and proctorship, giving people an ability to virtually dial in and see how surgeons are performing groundbreaking procedures around the world, but also going through surgical coaching where you may be working through a complex case and having another surgeon be able to dial in and work through that with you, almost like a coach in the wings working through those cases, is really valuable. We're also providing a lot of live and remote support through reps and through other industry players. And finally, we're working with groups and institutions around how can we expand their service capacity, where you may have a hospital that has multiple hubs within their hub and spoke model. And how do you ensure that you can deliver and amplify that expertise from one center to every other center within that system? And we're seeing a lot of interest around this, both in the UK and globally. Our use cases are varied. We focus largely on a number of key specialties around cardiology, where we've managed to use our solution to dial in experts to deliver life-saving procedures here in the UK, in the Middle East, in India, and in the United States. And it's very heartwarming 2 weeks ago when we did a case in India, allowing an expert from the United States to dial in, and they worked through a cardiac case. And the surgeons and the scrub tech actually gave a standing ovation at the end because they were so touched and moved by this solution being able to give impact to the patient that was on the table. Orthopaedics, we do quite a bit. Plastic surgery, of course, as it's my specialty, but also head and neck, being able to do training and education, layering that augmented reality tool on the anatomy, being able to talk through the surgical landmarks, colorectal and urology. And I think what's important to recognize is COVID is the accelerant. We are not blind to that. We see, and we've seen it across the board. I know many on this panel would have spoken to that as well. It's accelerated the behavior change that was going to happen anyway, but rather than it happening over a number of years, it happened over a number of months. And we saw the huge need for our solution, and our engagement grew in terms of users about 8 to 9 times. And the numbers of cases we were doing on our platform grew about 5 times. But we're always moved by the patient stories. This is Mo, a patient who had metastatic testicular cancer. And by using our platform, Dr. Fernando was able to dial in Dr. Jim Porter from Seattle, and they were able to work through this complex case robotically. He was able to guide her and mentor as he'd had a huge logbook of these cases, these complex metastatic cases. And they were able to work through that case. And she sort of described it as if she was a player on the tennis court and was having a coach in the wings. And that was a fantastic outcome. Mo went home at day 3 and was doing interviews on Sky News a week later. And of course, we have many other surgeons that do the same in colorectal. So this surgeon was working on a lap CME with another surgeon overseas, but he's able to also bring in the 3D tools and the 3D recons and DICOM files into that view. And they're able to make a much more meaningful discussion around how to proceed through that case. Everything she sees, he sees, and it's very much, in his words, it's as if I was there in person. And he often says, it's like I'm sitting in the control room. You can see everything that's going on. Audio is perfect, no delay, which you sometimes face when you're doing these live streams regularly on the internet. And that's thanks to our architecture that we've built. And finally, being able to deliver training for our future surgeons is so critical. It's about being stronger together. We partnered with ASSET, the Associations of Surgeons in Training, and many other groups to think about how do we deliver the workforce training that is needed across the country. And we run a lot of workshops now where Proximie is used on live or review cases. We're able to layer anatomy and structures onto that and really walk through the key components of an operation, which is so important for learning. And of course, we're incredibly humbled and proud to be partners with the UK military. We were selected against a very competitive tender against many blue chip companies. And we were selected because of our ease of use, our scalability, our security infrastructure, our ultra low latency and low bandwidth requirements. And it's incredible for us that our solution is being able to help our men and women on the front line get the care that they need instantly. We have been covered in the press quite a lot, and really it's usually about the human stories and the benefit, but we're very humbled and proud ultimately by the impact that we're making. And I think I'll just leave you with a final story, which is it's a case story. So this is a patient, a couple of years ago now. She was 55, 56 at the time. Unfortunately, she'd had an operation that went wrong. She had a laparotomy that didn't go to plan. She was in hospital in and out for years, had fistulas, was PEG fed, fed by a tube for a good 8 to 10 months. Eventually was left with a healed wound, but a pretty awful abdominal hernia. Every time she coughed, all the contents of the abdomen would be bulging out. And you can imagine for a woman her age, who's still very young, this was not really a good quality of life, to the point that she was desperate and asked us if her surgeon could perform the procedure but have an expert from the UK dial in. Her surgeon was keen on that as well. This was a complex case, and as he said, having 2 eyes is always better than having one, and being able to work through that with another colleague who has a lot of experience in these cases is always helpful. And so they worked through that case. She was in hospital for 4 to 5 days and was home then, incredibly well in herself. 6 months later, she was at the beach in a swimsuit and doing all the things that a woman of her age should be doing, playing with her grandchildren, enjoying life, traveling. And that patient is my mother. So I think, there's an element of a litmus test here. If you're willing to put your own mother through this, then, you do truly believe in the technology, which I do. It's always humbling to share this personal story with everyone, but I think it lends itself to the potential, the credibility, and how much I believe in it personally. So I really want to thank you very much. I hope that this is something we can continue to work on together. We're very open to collaboration. We believe in strategic partnerships, and we look forward to a future where every patient gets the best care the first time, every time. Thank you very much.
Hello, my name is Scott Petty, Chief Technology Officer for Vodafone here in the UK. 2020 has been an extraordinary year for everybody. Nobody knows that more than the health sector. Here in telecommunications, it's also been a super busy time, keeping our networks running and adjusting to the changing traffic patterns that the pandemic has demanded. As everyone moved to working from home, businesses had to adjust their capacity and the way their networks worked. We had to support government across a whole range of sectors to ensure that those services continued to run smoothly. I'm really proud of our performance throughout the pandemic, especially of our engineers who worked very hard to ensure stability of the networks, ensure that we were always able to cope with our customers' demands. A key success factor in being ready was really that we're constantly modernizing our networks and evolving for new technology. Of course, we're getting ready for 5G. As part of 5G, we've been modernizing our core networks and moving to cloud-native technologies. That gave us tremendous flexibility in the way we could adjust for those traffic patterns, spin up additional capacity, and ensure that we were ready for any spike in the network no matter where it occurred. That resulted in fantastic stability from the very first days of lockdown all the way through to today. We worked hard to also support the health sector through this process, from connecting the Nightingale hospitals with free connectivity, ensuring that there was enough capacity for those sites to be able to perform optimally for patients as they arrived. We also run the NHS 111 service. Over a few short days, we're able to double the capacity to be able to handle more than 2,400 calls simultaneously into NHS 111, and we've been monitoring and continuing to upgrade that service constantly throughout the process. We also were able to support and equip more than 1,000 retired health workers and GPs with software to work from home as a remote call centre, leveraging the things we'd learnt from our own call centres working from home to assist NHS England staffing the free service. The additional workforce was up and running in a few days and has been performing very well throughout the entire pandemic. We also provided and enabled NHS Wi-Fi calling connections in the NHS South, Central and West support units to ensure that people could always have access to telephony services no matter where they were and able to use their mobile phones effectively. Of course, we offered free unlimited connectivity for NHS staff and workers for 6 months throughout the pandemic to ensure that they could talk to their loved ones and always be in contact with their family. So it's been a super busy time in telecommunications, supporting the health sector through the COVID pandemic and ensuring that as a country we were able to continue to operate and keep the economy running. We're really excited about where we are in the technology lifecycle for networks. Of course, we started deploying 5G last year. 5G we're deploying right now is what's called non-standalone. So it leverages our 4G network to create a 5G coverage map across the country and to offer increased speeds to our customers. Early next year, though, we'll launch the second phase of 5G, which is called standalone 5G. This enables a whole set of new features, greater speed for devices connected to our network, but most importantly, low latency, which enables augmented reality and virtual reality applications, really important in remote telemedicine applications in health. It'll also enable massive IoT devices, so services such as connected ambulances, and be able to connect infinitely more sensors to the network than we can today in a very reliable way. Underpinning that and supporting that is massively increased security and the ability to guarantee end-to-end performance through a technology called network slicing. So 5G will enable a whole host of new applications in connected health and connected services, and ensuring that we can manage and look after a much broader range of devices. To be ready to cope with 5G, however, health needs to also modernise, build new applications and services, and digitise the platforms to really leverage the benefits that we can see with 5G. Vodafone is looking forward to working with the health sector to help you through that modernisation process. We've built great experience in modernising our own networks, and I think we have a role to help the health sector as you go through a massive growth phase and capture the opportunities that 5G will offer.
We take some time now to meet one of the clinicians in the field who will be the user of the new technologies that we can bring through the power of 5G. With that said, I would like to introduce Ali Phillips from Southampton General. So Ali, welcome today. Why don't you go ahead, Ali, and introduce yourself, please?
Good morning, Danny. Thank you very much. My name is Ali Phillips. I'm a consultant orthopaedic surgeon. I'm head of trauma for orthopaedics at Southampton, and also lead for education for major trauma.
Brilliant. So look, Ali, thanks very much for joining me on this topic today. Why is the topic of innovation and technology important to you personally?
I sit on the augmented and mixed reality committee here at Southampton, and I'm surrounded, when I look around me, by the most phenomenally intelligent people. They are some of the most high IQ people I've ever met, and they're doctors and senior nurses who just want to make things better. Yeah, we all like a bit of tech in our lives, and we all like to play with new and fun stuff. But in order to get all that going, we need to innovate. We need to make it interesting. We need to use all these applications to make our patients' lives better. And yeah, we have a little fun along the way.
Yes, and so look, Ali, Vodafone, as you and I know, we've talked many times about this, but Vodafone's investing heavily right across the UK in terms of the introduction of our 5G networks. That will bring lots of benefits around latency and bandwidth and speed, and those attributes will really open up a number of new applications that we can bring to bear, especially in the healthcare sector. From a transformational perspective, what is it you're looking forward to in terms of adopting those new technologies in healthcare?
We're a huge university hospital. Even before COVID times, we still did remote lectures. We still did remote all sorts of things to teach and train. You can't get 300 students from a single year into the same room necessarily. And even now, that's a complete no-no, of course. So, let alone the university, we have registrar training every other week for the whole of Wessex. We have students and professors from abroad who want to learn some techniques that we do. There's quite a lot of stuff at Southampton that only we do in the entire country, centres in the entire world. So getting that information out there in a meaningful way requires a network that functions, requires a network that isn't glitchy, requires a network that actually does what we want it to do rather than what we've got at the moment. This is all about patients at the end of the day, and the ultimate user of my services and ultimately your services within the healthcare sector are patients. I think we're a digital exemplar at Southampton, and I feel very lucky, but the grass is always greener, isn't it? And I think with 5G coming along, the grass is an awful lot greener. I don't think a lot of my colleagues know how green it could be. And I think that's really, really interesting to get that message out there too.
You're completely right. It's a great message. We're seeing 5G does absolutely bring the ability to transform a number of industries. We're seeing this right across industry, whether it's transport, logistics, manufacturing, and healthcare is definitely at the forefront of that technology adoption. But we understand as well that there is a number of barriers, Ali, in terms of the adoption, whether that's at a network level or at an application level. What's your experience in terms of the challenges that you face in the hospital in terms of the adoption of this new technology?
I was on call all last week, and I tried to get communication, and that's the essence of what I try and do in my week on call, so that everybody can get hold of me. And yet, half a dozen times last week, I couldn't even receive a phone call. People would call me on a landline because they knew I was in my office. And they'd say, I just tried to get hold of you. Where were you? And I said, well, I was wandering around the hospital doing my job. So, even at a very, very simplistic way, that is a problem. And then you step it up to theatres and you're trying to implement something like Proximie augmented reality setup, where you're trying to train and teach, or even, as I have done recently with open fractures, tried to get my colleagues to give me an opinion remotely when they weren't even necessarily in the hospital. And it's glitchy, I can't hear them, it takes a long time to set up and connect all the application with the network. It's frustrating to say the least, and I don't have the time to go through and work all that out. We're all busy clinicians, we don't have the time to sort that sort of networking problem out. So if it worked perfectly, man, you'd make an awful lot of people very, very happy.
So it's frustrating to hear that we're still facing some of those real basic challenges in terms of communication needs within the hospital. Here we are today talking about the advancement of 5G and not unlocking new applications such as augmented reality or virtual reality, remote patient monitoring, remote education within the hospital environment. But yet at the same time, within the hospitals, they are faced with significant challenges just in terms of basic communication and digitalization. So how is it that we can work closely together, more closely together to resolve some of those challenges? Because if we don't get that fixed, Ali, we'll not be able to take advantage of all of the great benefits that we can get now from a 5G perspective.
Thanks, Danny. And I really appreciate the opportunity to work like this, because what we need to do is to build from the ground up. It's all well and good coming in and having these great aspirations, but actually if we don't deliver the basics, then it's not going to work for the rest of it. And just getting a simple one theatre working, one theatre having access to fantastic network, and then other people being able to dial into that to see, having one ward, one bed even, where we can remotely access their statistics. That's all we need to start with. If we can show that we can do it on one individual level, and then make it two, and then two theatres, a whole floor, we have to build it up like that, because the important things for us as a trust are communicating with our students. That's absolutely vital. But communicating with our patients, we just need one computer to work with one patient to start with, and then go up from there. Yes, we've got some wonderful ideas and wonderful innovations. We're looking at Google Glasses and HoloLens and all sorts of things. That all chews up bandwidth. So actually, I want to put a 4K camera on my forehead when I'm operating. I want to have a 4K camera looking at the operation as well. I want to have a 4K camera in the corner of the room doing human factors research. And we can't do any of that if we don't get the actual bandwidth within that theatre right to start with, let alone the whole hospital. It's a grand plan. It's going to take a while, but I truly believe it's the only way to do it from the ground up.
Yeah, I think that's some great advice, Ali. We have to find a way in which we can deploy both the network technology and even the applications themselves in a small scale but flexible and scalable way, so that we can begin the journey together in a confined environment, and then allow that to grow. That will give us advantages in terms of the cost of network adoption or the cost of the application adoption, and then we can grow from there, prove out the benefits, build out the business case together, prove that this can really work. But it is dependent, I suppose, on the network operators and the application providers to collaborate together with you, the clinicians in the field, because we understand actually it's the proximity to the problem statement. If you're very close to the problem statement, you typically know how to answer the challenge. Vodafone and other network operators, they tend to have spent a lot of time building great relationships with the procurement teams in hospitals, but actually it's clinicians in the field who really understand the challenges that they face and the applications they need to resolve them, Ali. So if we can work together in the future, as we have begun with our relationship, to understand what's the challenge, what's the outcome we're trying to achieve, and actually how do we begin to do that, but do it in a secure, in a flexible and a scalable way, then I think we've got a recipe for success. So look, Ali, with that said, thanks very much for sharing your thoughts with us today. It's been really useful to get that insight, and I look forward to working with you in the future.
Thanks, sir.
Thank you so much. What a great video and presentation from Vodafone. Great thanks to Ali, of course, Nadine, Scott, and Danny for a wonderful presentation. Also, giving us a vision around the future of healthcare, where 5G might support us in that mission. So that's been amazing. So thanks so much to the Vodafone team. We have a few questions, Danny, if you're here to join us for a few questions from the audience, and I have some of my own, of course. So let's go to the top. Jocelyn Loma asked a question about collaborative decision-making. And the question is, in order to access remote experts, what does the next generation of collaboration really look like? So I think that's quite an open question, I guess, Danny. What are your thoughts on that?
Yeah, I mean, it's an interesting question. I think what we now get, Shafi, with the introduction of 5G is the ability now for us to adopt a number of applications, and we'll see a lot of new applications being developed and brought to market that can take advantage of the low latency, the high bandwidth, and the speed elements that we can offer as a guaranteed service from a 5G perspective. So when we talk about 5G, it's quite important that we talk about the ecosystem that we build around the 5G partnership. So what we'll now see in the market is a lot of ecosystem partners who are very keen to develop best-in-class capability that take advantage of those attributes of a network that can offer those attributes, and that's an interesting area. So there's already capabilities in this space today. Nadine was on talking about her capability from a Proximie perspective. That's certainly one in the market. You know, we're partnering there with Nadine to help bring that to market, but there will be others for sure.
Yeah, I'm sure. And of course, if you look at the long-term future, people talk about avatars, holograms. Who knows where that journey might take us in the future about remote collaborative work, Danny. But it's all very exciting, of course.
Correct.
Yeah, sure. Next thing is really around, I think Thomas has a question around the fact that 5G is still relatively new, I guess, from our perspectives. Are there any concerns about its reliability to consistently work? What's your thoughts around that, Danny?
Yeah, I mean, great question. Look, 5G comes in all different shapes and sizes. 5G, you know, whether it's a private network, a public network, is it an in-building 5G coverage scheme? Is it? So we have to look at what is the end application, what is the requirement that we're looking to deliver, and then we determine what is the best-in-class capability to deliver that. So if it was a public 5G network, of course you have to worry about things like contention or spectrum availability that you're contending with across the public network. However, in a healthcare setting, for example, in a hospital setting, if we were delivering a 5G capability for example, remote surgery or one of these advanced technologies, you'd certainly do so with a private network. And with private network, of course, we can offer guaranteed SLAs around the latency and the bandwidth to give you that assurance of the application. And of course, it's not just about the network. We also have to consider the evolution of edge computing. So where does the compute power happen? Taking it right down to the edge. So for example, you wouldn't sit behind the wheel of an autonomous car in the UK using 4G network, you know, contended on a public network spectrum and all of that compute power happening in the cloud. You actually need that to happen across a 5G network, and for that to happen at the edge, you know, so we can have that immediate decision-making capability. So it's really important that we take both 5G and edge compute capability, combine them together, and that enables us to offer in a mobile private network environment guaranteed service levels to ensure those applications work in real time.
Thanks for that. I guess the next question really is probably for me. I think Chung Chong asked the question about what are the ethical implications when a procedure were to fail? Will it fall upon the acting surgeon or the virtually dialed in surgeon from elsewhere too? Or can we, in fact, blame the network, Danny? I'm just, of course, from that perspective. So from my perspective, having streamed many live operations in the past and done remote working, I think this area needs some work on. I think Danny mentioned the autonomous car industry, and I look forward to that. I look actually quite excited about what they're doing, because they're asking the same questions. If, for example, a car fails, if it's autonomous driving like a Tesla, for example, who's at fault? Is it the software? Is it the company? Is it the person who's supposed to be driving the car, but autonomously? So those kind of questions have already been asked in other industries, and that's why it's important to work around other industries. And those questions, the difficult questions, hopefully will help us in healthcare work out our own answers. I think ultimately it has to be, of course, that there's some responsibility from the surgeons themselves and also the hospital or the platform you're working on, so that you will share that initial responsibility to make sure it's safe and effective before you start doing the remote operations. So I think it's about being slow and methodical, as well as using the speed of technology at the same time. So I think it's a mixture of both. There's a lot of other questions we'd like to ask you, Danny, whilst we've got you here for a few minutes, if you don't mind. So there's obviously a lot of question in the kind of Western world around security concerns. We've seen that, the involvement of Huawei in terms of their 5G technology infrastructure, a lot of people pulling out from their ecosystem. What risks exists at the moment, and how is Vodafone mitigating some of them?
So we currently don't see any risk at the moment in terms of the way in which Vodafone is deploying its 5G networks. Of course, we're working really closely, Shafi. It's a good question. We're working very close with the UK government and following their guidance. So just in line with our guidelines, Huawei will not be used in our non-core infrastructure. And of course, Vodafone has never ever deployed Huawei in our actual core network. So therefore, following the guidelines from the British government in terms of the how we should and shouldn't use Huawei, we don't see our 5G networks impacted in any way.
That's really good to know. I'm sure reassuring for the audience, obviously, around the future of 5G. The other thing is whether the whole 5G, the whole country is connected through 5G, or there's still dead zones. I mean, what are your thoughts around that at the moment, Danny?
Yeah, so look, we're all operators in the UK are in the middle of deploying their 5G networks across the country. So we have 55 major locations across the UK covered at the minute from a 5G perspective, really going after the big population centres, and then we roll on out to the rest of the country. But remember, just as I mentioned earlier, Shafi, 5G comes in very different forms. So that's very much with regards to the public 5G network. That's what you and I would use if we picked up our phone, had a 5G phone, and we were streaming some services across the 5G network. However, the 5G that we're really talking about here, when we talk about autonomous vehicles, or we talk about healthcare use cases in hospitals, when we talk about the advancements of the technologies that can really transform industry, we're really looking at very different 5G schemes. Those would be dedicated 5G schemes, such as an in-building 5G scheme, which we would connect to our core, or a mobile private network dedicated to the customer's applications, and again connected to our core. And in that scenario, Shafi, there is no part of the country that we cannot cover today with that type of 5G connectivity. Regardless of where the building is in any part of the country, we can bring 5G for that deployment.
And that's so important in healthcare, of course, Danny. Obviously, as we have this digital revolution, there's vulnerable people out there who may not have access to digital technologies. How do we encourage them? And if in the future we can have that connectivity across the UK, it gives rise to an equitable structure for healthcare. So thanks for clarifying that. We also see in the press and sometimes conspiracy theorists, Danny, around the health impacts of 5G. Are there any negative health impacts in 5G that you're aware of, Danny?
Yeah, it's unfortunate that 5G got off to a bad start. I suppose globally, in terms of some of the negative things that have been said about it, but the reality is there's no single study has been able to show a single adverse link between 5G and health. And in fact, the World Health Organization themselves have concluded the same, that there is no known risks. So we're very, very confident that 5G, it's a spectrum no different to 4G. It gives us better benefits in terms of speed and latency and bandwidth. But there is no impact to health in the same way that there's no impact to our health from 4G.
Yeah, I'm glad you've said that. And I've also read up widely on this. And I can honestly say, as a doctor, 5G doesn't appear to have any negative impacts in all the papers I've seen so far. So I'm very reassured that this is certainly going to be part of our future. The other, I guess, area is around the collaboration with government. So how can the government help speed up the adoption of the technologies like 5G in the NHS? And perhaps your experiences of how you've navigated our healthcare system.
Yeah, I mean, it's an interesting one, actually, and there's almost a pre and post COVID conversation to be had here. I think pre-COVID, we've seen a lot of government push into not just healthcare, but all industries in terms of the adoption of 5G in some way for transformative outcomes. Of course, we're in a global race against other countries in the world who are also doing the same to transform industry, leveraging the new capability that the 5G offers us. And therefore, we did see, and the government has been very active in this space, so there's circa £65 million worth of investments pushed in through a number of programs. We had Innovate UK, we had the DCMS part-funded programs across the UK into every industry vertical. But interestingly, what we've also seen, Shafi, is that was very much pre-COVID. During the COVID pandemic, we've seen a massive pull from industry, in particular healthcare, manufacturing. There's a number of industries that were saying, okay, how can we use 5G to transform our services? How can we do remote production line monitoring, for example, in manufacturing? How can we do remote assisted surgery, for example, in healthcare? So the government have been very, very active, in terms of enticing the industry to have a look at this technology. But I would say the pandemic has actually made everyone think differently around how can we leverage this technology for good, how can we transform our industries, and how can we move forward, delivering, for example, healthcare in a very, very different way, leveraging 5G. So it's an interest in both push and pull.
Thank you for that. Obviously, one of the most important people involved in healthcare is, of course, all of us, the patients. So do you have any evidence from the patient perspective from Vodafone? I know you've done some work on this already, around their attitude and response towards technology for conducting consultations and delivering treatments and operating.
Yeah, so we have absolutely looked into that, and we've produced a report that's available on our, in fact, I'll share a link in the chat group, in terms of patients' behaviours, in terms of their willingness to accept healthcare and healthcare provision being delivered in different ways. I think patients are quite keen to understand actually how they can access services from their doctors or hospitals from home, and especially patients with acute illnesses. How can we stop those trips to the hospital? How can we remove those unnecessary journeys? How can we give access to, for example, GP surgeries, through video conferencing? Remember, we're moving into a world where 50% of the workforce are millennials today. They expect to engage in a digital format, and that is true of the healthcare space. So through 5G, whilst we have seen a number of trials across as a result of the pandemic, we've seen a complete willingness to accept new ways in which you engage healthcare, and that's exciting for all of us, because I think it gives the opportunity now for us to rethink how those traditional services that have been delivered through the same channels over a number of years, how can we rethink those? How can we take the technology advancements and make patient care easier to deliver a better outcome for patients?
Thank you for that. I'm really glad that you've engaged the patient population. It's one of the great things about Vodafone, having the stakeholders together to kind of redesign, reimagine what healthcare looks like in the future. I think our last question we'll ask an audience, which is Dr. Gurpinder Singh Baidwan, who asked us a question around 5G rollout. The initial costs are quite high. How the networks ensure that the use of this technology will not lead to postcode lotteries or increasing health inequalities? I think you alluded to that in one of the other answers, but if you could do that again, that'd be great.
Yeah, absolutely. I mean, it is a really important question. So 5G will eventually be available from a public network perspective across the entirety of the country. But of course, we don't need to wait for that in terms of delivering a number of services to patients today. We can use 5G as the springboard for us to rethink the way in which we can deliver services. And of course, when you're a patient at home receiving patient care from home from your local practitioner or whatever it may be, it actually could just be on Wi-Fi or broadband. But to bring it back to 5G, in order for, we kind of touched upon this previously, I can deliver 5G in very different formats. We have, of course, access to the public 5G network. However, we can deploy 5G, for example, as an in-building coverage scheme into a hospital in a very remote location. And for example, we can convert simply just one operating theatre, and the cost is not expensive. We are in just the tens of thousands, of thousands of pounds. So I think there is certainly a view that this will be prohibitive in terms of cost. It's incumbent upon the network operators to find a way in which we can deploy this technology in a scalable, flexible and secure manner. And we've done a lot of work in the background. So you heard Anne up front saying, let's work together. Let's think about, okay, how do we prove out the business case? How do we, for example, deliver just one 5G hospital bed, or just one operating theatre, or just one connected ambulance? And let the hospital understand what's the return on investment, does this pay back, and actually can we make this scalable? And therefore, we have to work with the application providers, ourselves, the network operators, and of course the procurement teams to understand how we can do this together. But we completely understand the need to do this in an agile and iterative approach.
Thank you so much. That was really a good way to, of course, finish out our conversation. So I'd like to thank, of course, the Vodafone team and also, of course, you, Danny, and Anne and the others to really support healthcare going forward. I love the ambition from Vodafone. I love the fact that you're trying your best to improve patient outcomes. and actually in doing it the right way. So hopefully our audience have enjoyed that. I'll leave you with, of course, a Churchillian quote, because this is not the end. It's not even the beginning of the end. It's the end of the beginning for the world of 5G and going forward. I'm so grateful for share all the work you're doing, and good luck, of course, with the team in the future. Thanks, Danny.
Thanks very much, Shafi.